All right, let's jump right in. Today, we are talking about something absolutely critical for anyone in a caregiving role, and that's preventing skin breakdown. Making sure a client's skin is safe and healthy is just foundational to their comfort and their overall well-being.
So what are we actually talking about here? Well, skin breakdown is basically when the skin, our body's biggest organ, starts to, break down. This isn't just a simple rash. We're talking about a real loss of the skin's integrity. And the main culprits? Usually, it's prolonged pressure, friction, or too much moisture. Think of the skin as being under a constant siege, and our job is to be its best line of defense.
So, that's the problem, right? Which of course leads to the big questions. Who is the most vulnerable here? And more importantly, what can we actually do to stop this from happening? That's exactly what we're going to get into.
Okay, now this is really important. We've got two kinds of risks. On one side, you have fixed risks. These are the things we just can't change, like someone's age or the fact that they live in a long-term care facility. But look at that other column, modifiable risks. This is where you, as a caregiver, have some real power. These are the things we can actually change to protect the people we care for.
To be effective, you've got to know what you're looking for. Think of yourself as a detective. These are your clues. We're talking about subtle things, like changes in skin temperature. Does it feel warmer or cooler than the surrounding area? Is there any discoloration or redness? What about spots that are way too moist or way too dry? Or, of course, any visible inflammation or actual breaks in the skin. These are the signs that tell you something's wrong.
So how do we fight back? We use a toolkit, a set of 5 essential strategies. And this isn't just a random list, it's a whole proactive plan. It all starts with regular assessments, moves on to skincare, relieving pressure, getting nutrition right, and it's all held together by education. So let's break these down one by one.
First up, those regular skin assessments. And I want you to really notice the frequency here. At admission, yes, but also during every single shift. This is not a once-a-week thing. That constant watchfulness is what makes early detection possible, and early detection is everything.
And where are we looking? Well, you want to focus on the high-risk hotspots. We're talking about those bony areas like the tailbone, the heels, and the elbows, places where pressure really builds up. And here's a huge one that's easy to miss. Don't forget to check under any medical devices or braces. Skin breakdown loves to hide in those spots.
Now, I want you to remember this next number. It's really important. 4. Just 4 hours. That is how quickly a pressure injury can start to form. It's not something that takes days to develop. It can happen in the span of a single afternoon. And that fact alone shows you how urgent our next strategy is.
So the mission is to relieve that pressure. For anyone who can't move on their own, repositioning them regularly, think every 2 hours, is absolutely non-negotiable. You can also use specialized support surfaces, special mattresses and cushions, that help spread that weight out. And remember, pay special attention to the heels. They're a really common spot for serious injuries.
But here's the thing. Prevention isn't just about what's happening on the outside of the body. It's also about building up strength from the inside. Just look at this chart. A malnourished person is 4 times more likely to develop a pressure injury. This just shows you, plain and simple, that what we put into the body is just as important as how we position it.
And we're not just guessing here. We've got the data. For patients who are really vulnerable, things like high-protein nutritional supplements can actually slash the risk of pressure injuries by up to 25%. That is a huge, measurable impact that we can help support.
Okay, let's get really practical for a second. Imagine you see a red area on a client's skin. What do? Well, here's a simple test. Normal redness from just sitting or lying down will usually fade within about 20 to 30 minutes. But, and this is a big but, if that redness doesn't fade, and especially if the area feels warm or firm to the touch, that is a critical stage 1 warning sign. That is your cue to act right now. And what does acting look like? It's a clear 3-step process. First, document everything. Where is it? How big is it? What does it look like? Be super specific. Second, report what you found to your supervisor immediately. Don't wait. And third, make sure you follow your agency's specific policy for reporting incidents. This is where being professional and following procedure is just so important.
This all kind of boils down to a simple set of do's and don'ts. So, do perform those daily skin checks. Do reposition regularly. Do use gentle cleansers and barrier creams. Do keep an eye on nutrition. And do document and report changes right away. And on the flip side, don't just assume everything's fine without looking. Don't leave people in one position for hours. Don't let moisture just sit on the skin.
Don't overlook changes in appetite, and please, absolutely, don't wait to see if it gets worse.
And that's really the bottom line, isn't it? Your careful observation is the first and most important line of defense. Always escalate any concerns you have, and always do it by the book. Follow the person's care plan and your agency's rules. All right, you've been listening, so let's do a quick knowledge check. First question, a pressure injury can start to form in as little as how many hours?
If you were thinking 4 hours, you got it. It's a pretty shocking amount of time, right?
Okay, next one. True or false? Malnourished patients are 4 times more likely to develop pressure injuries. What do you think?
That one is absolutely true. It's another one of those powerful stats that really shows the link between nutrition and healthy skin.
And last one, thinking about that day-to-day care, what kind of cleanser is recommended after an episode of incontinence?
Yep, the answer is a pH-balanced, no-rinse foam cleanser. It's designed to be gentle but effective on fragile skin. Awesome job!
And all of this brings us to the main takeaway. Success here is about the whole picture. It's not just one thing. It starts with that comprehensive assessment, and then it's supported by consistent skincare, proper turning, the right support surfaces, and making sure nutritional needs are being met. Every single piece of that puzzle matters.
So I'll leave you with this thought. You have the toolkit now. You have the knowledge. The real question is, what's one small change you can make tomorrow, the very next time you're on shift, to better protect the skin of someone you're caring for?